I want to give you an update of where we are on securing accurate data for our community. Our goal as a board is to be as transparent with our community as possible. We will continue to share with you the data we are analyzing. As a city board, we have done our best to make decisions based on CDC recommendations, input and guidance from local healthcare professionals, and data. Timely data is becoming hard to come by through the Mississippi Department of Health. Dr. Dobbs has been very helpful in relaying the process they are going through at the Department of Health and how they are receiving and analyzing data. I'm going to try to explain where we are. Bear with me, there are a lot of moving parts. It is my understanding that the data is reported to the Department of Health by several sources. Labs send positive case reports, clinics send positive case reports, and forms are submitted as requested by the Department of Health. These three reports must be reconciled to identify any duplicates before this data is reported. This is very time-consuming, and the software that the Department of Health has in place is not up to the task, so it is basically done manually. Earlier in this pandemic, perhaps that was manageable, but with rising numbers, it becomes more difficult. Like many departments in state government, the infrastructure is simply not in place to keep up with this level of reporting. So it may go something like this. Medical clinic sees a big increase in patients being tested for COVID-19. They send tests off to the lab company. Lab company sends positive results back to the clinics as soon as they get them. So local clinics know first of increases in cases. The lab company submits reports to Mississippi Department of Health over the next few days. That clinic may call in to report this spike in cases to Department of Health or may send it on a report. The case could be reported by the lab, by a called-in report, and then on the form. This means reconciling all reported cases is critical. I've asked questions about the software, and unfortunately, it is something that has been requested by the Department of Health over the years, but has been cut out of budgets. The Department of Health is truly doing the best they can with outdated software and too few employees. We believe it is critical for us to evaluate data for our community daily in order to determine how to best protect our residents. We understand that we have not been getting the complete picture with the delays and the fact that residents who list an address outside of Lafayette County are not in our case reports from Department of Health. I know that capturing this data at a state level is difficult and time-consuming. I fully believe Department of Health is doing all they can to correct this reporting process, and I know that they will continue to work with us to access this data. We believe that the only way to capture accurate, timely data at this time is to collect it locally. For the immediate future, we have asked the 14 locations we know to be conducting tests in Lafayette County to report numbers directly to us. We have provided them with an easy electronic way to report this data. Mississippi Department of Health reported compiled data from 5 days, June 17th through the 21st, on their site late yesterday afternoon. A total of 1,646 new cases were reported across the state, with 45 of those cases being reported in Lafayette County. These numbers have not been broken down by specific days, but regardless of what day the new cases fell on, this 45 case spike in 5 days is the largest spike Lafayette County has seen over a 5-day period during this pandemic. And this 45 case increase does not include non-Lafayette County residents. We are seeing an approximate 10-day lag time in state reporting from date of testing to date the person is contacted from the Mississippi Department of Health. We believe there to be 85 cases as of today in Lafayette County, not including non-Lafayette County resident. We are in daily contact with our hospital administrators. Although our numbers of positive cases are spiking, our hospitalization numbers are creeping up, but not spiking. We had our largest number of reported COVID-19 patients hospitalized this past Saturday, and that occupied 8.3% of the total beds available. As of last night, 3.2% of the hospital beds available were occupied by COVID-19 patients. We believe these hospitalization numbers are not spiking due to the age group of largest positive case increases being 18 to 24 years old. Along with new positive cases and hospitalization rates, we also track how many cases are active presently at any time in our community. We know that the active cases are where transmission comes from. On our website, oxfordms.net, you can see a chart where we back out the cases that are 14 days recovered so that we can see what our active cases actually are. The numbers are never going to be exact, but we need to be able to address large spikes, and we need to be as accurate as possible to identify trends. As we receive data from our local clinics, we will pass it along to you. These large increases make it evident that the battle is not over. Many of the positive cases are said to be asymptomatic. If you are diagnosed with COVID-19 and feel fine, you should still quarantine for 14 days. If you are waiting on test results, it is essential to remain at home if you have symptoms of COVID-19. Do not go to work or leave home. If you're waiting on test results from a routine screening but have no symptoms, you should always wear a face covering if out in public until you receive your results. We have been asked about implementing more strict policies. It is our firm belief that the appropriate policies are in place. They are only successful if followed. Please wear a face covering in public, not for yourself, but for others. I know the masks are uncomfortable. I know you're tired of this pandemic. Me too. But when I wear a mask in public, it's not because I'm living in fear of the virus. It's because I want to be part of the solution, not the problem. We are stronger together. Thank you.